Hello everyone, I am Ray Kenneth Ligan and I am going to talk about basic surgical instrumentation and assisting minor operation. Basic surgical instruments are specially designed tools that has a distinct action or task during a procedure. The purpose of this is to help the procedure during the surgery and of course to help the treatment of the patient. Assisting minor operation. Minor operation is a surgery involving a little risk to the life of the patient, specifically an operation to the superficial structure of the body or a manipulative procedure that does not involve a serious risk. The purpose of this is to assist the physician performing a surgical procedure and of course to provide support to the patient. That is the purpose of assisting minor operation. Now let's demonstrate the procedures in preparing and proper handling of surgical instruments. Now first, let's get the surgical instruments and arrange it in a scabon technique. Scabon stands for straight forceps, curved forceps, the Alice tissue forceps, the Babcock forceps, the Ochsner forceps, the needle holding forceps, and lastly the tissue forceps. This arrangement of surgical instruments avoid confusion when a certain instrument is needed by the doctor during the procedure, thus facilitates the flow of the procedure. Now let's attach the blade to the blade holder. So how are we going to do that? First, this is the blade and this is the blade holder. So grasp the blade with a Kelly forceps or the needle holding forceps and locking it in place. Since we don't have the actual forceps, we are using an improvised one. So grasping the blade with a Kelly forceps prevent accidental cuts in the nurse's hand and facilitate easy attachment of blade to the blade holder. Now you have to make sure that the blade number is facing towards you. The blade number is located opposite to the blade's sharp edge. By facing the blade number towards you means the sharp edge is not directly pointed to you, thus helps avoid accidental cuts and risk for injuries. So hold the blade holder with the number facing towards you and inclining it in an angle downwards, pointing the tip of the holder towards the tray. So this will avoid accidental cuts and stabbing yourself when you are going to attach the blade to the blade holder. With the blade in the needle holder, slide the blade to the blade holder and lock it in place. Using the needle holder provides security and convenience when attaching the blade to the blade holder. Now let's attach the ATR to the needle holder. So this is the needle and this is the ATR suture. So when attaching the ATR needle to the ATR suture, we need to use a needle holder to secure the needle in place. So this will facilitate the attachment of ATR suture to the needle. When you are assisting in a surgical operation, you need to listen to the doctor's request of the chosen instruments. This will avoid giving the wrong instruments and facilitates the flow of the procedure. And also, pass the requested instruments with dexterity. Dexterity means the ability to act and think quickly. So as a nurse, you must always quick and ready at all times. You should not be mentally occupied to avoid errors in passing the requested instruments. So next is handling the blade. So pass the blade by holding the serrated markings at the middle of the blade. As you can see, that is the serrated markings. This will provide space for the doctor's hand when transferring the blade and to avoid accidental cuts and risk for injuries. So when handling the blade, cover the sharp blade by holding it in the serrated markings, pointing the handle first. So handle of the blade should be offered first. This will avoid stabbing or cutting the doctor's hand and facilitates the transfer of the blade. So next is handling the scissors. So pass the scissors by holding the lock box. So this is the surgical scissors and the lock box is located in the middle of it. So holding it in the lock box provides a firm hold in the scissors and prevent pricking your fingers. So the tip of the scissors should be always upward, and also in passing the instruments to the doctor, the tip of the scissors should be always visible as well as the handle. So this will ensure that the instrument is correct and for the doctor to see the handle to grasp it. So pass the scissors handle to the doctor's palm, making it snap gently. So I will show you a video on how to do it. So snapping it gently provides stimulus to the doctor's hand so the grasp reflex will be initiated. So next, we are going to talk about handling of grasper. So this is the grasper, as you can see. So pass the grasper by holding the lockbox. So this is the grasper. The lockbox is located here. So you are going to hold it in that position, provides firm hold in the graspers. The tip of the grasper should be upward. It should be upward like that. So the hand of the doctor, as I have said, is at the waist level. Holding the grasper while the tip is upward provides a space for the doctor's hand when passing it, thus promotes safety handling of the said instrument. So in passing the instrument to the doctor, the tip of the scissor should be visible as well as the handle. Just like passing the scissor, so it should be visible, the handle and the point of the grasper. So this ensures that the instrument is correct, or the doctor will see the handle to grasp it. So next, pass the grasper to the doctor's palm, making it snap gently. So I am going to show you the video. So passing the grasper handle to the doctor's palm, making it snap gently, gives stimulus to the doctor's hands so the grasp reflex will be initiated. So last thing that we are going to do is attaching the ATR to the needle holder. So this is the ATR needle and this is the ATR suture. So grasp the ATR at the juncture of the suture. So this is so grasp it and the needle with the needle holder. So you are going to use the needle holder. So like that. So using of needle holder provides a secure and convenient attachment of ATR to the needle. Like that. And this is the ATR suture, as you can see. Now, adjust the needle with the needle holder, making it sure that the right position in accordance with the surgeon's hand. So to avoid risk of injuries like pricking the hand of the surgeon or the gloves of the surgeon. So that ends our preparation of the surgical instruments. Now prepare the mayo tray. So this is the mayo tray, and I am going to cover it with an instrument towel. So this mayo tray provide a sterile place for the surgical instruments, and by using a forceps in unwrapping the instrument towel, maintain the sterility in the area. So I am going to use this as a forceps, as a sterile forceps, since I don't have the actual forceps, and this is only an alternative. So I am going to unwrap the instrument towel. So using the sterile forceps, adjust the placement of the instrument towel in the mayo tray. So I am going to adjust it to fully cover the mayo tray. So this maintains sterility in the area. So using of the sterile forceps, maintain the sterility of the instrument towel while adjusting to fully cover the mayo tray. So next thing that we are going to do is to add the sterile instrument pack aseptically. This will maintain the sterility in the area. So you are going to unwrap the sterile instrument pack using a sterile forceps. This will also maintain the sterility of or in the area of the sterile field. Now add all the surgical instruments and also the other materials that are needed during the surgery. Now after you put all the instruments and the materials in the sterile field, you have to don your sterile glove to maintain the sterility in the area. So after you've done your gloves, so you have to arrange the instruments in a scabon technique. Now here are the surgical instruments that are being arranged in a scabon technique. So we have here the forceps, and we also added the other sterile materials in the sterile field like the syringe, the grasper, the needle, the suture, and the surgical scissors. We have the blade and the blade holder and a gauze pad. So putting it in a sterile field maintains the sterility of the material and the instrument. So make sure that you have to distance your materials 1 inch away from the corners of the sterile field, because according to the principles of asepsis, the corners or the 1 inch corner in the sterile field are considered contaminated. So to maintain the sterility of the materials and the equipments, we need to move 1 inch away from the corners. Next is to serve the instruments to the surgeon properly. This will ensure a safe procedure and avoid risk of injuries. Now after that, we need to assist the doctor in suturing. This will help and facilitates the procedure. After suturing, we need to cleanse the operative site using a normal saline solution. Since I don't have the actual normal saline solution, I will have here an alternative. So this is an alternative. So this will maintain the sterility in the wound area. Now next thing to do is to apply a betadine solution. We have here an alternative for the actual betadine. So betadine helps kill the bacteria or germs that can cause wound infection without pain sensation, unlike alcohol solution. After is to apply a dressing to the operative site. So this will protect the wound from infection and enhances the progress of wound healing. So in applying a sterile dressing, we need to clean the operative site first and apply a gauze pad or a sterile pad and secure it with a tie tapes or tapes. So putting a wound dressing absorbs the drain from the operative site, thus enhances the progress of wound healing. Next is to do an aftercare per agency protocol because every hospital has their own way of cleaning. This will maintain organization and cleanliness to the area. And lastly is to document relevant information. This information will serve as the baseline for the continuation of care and for legal purposes. So that ends our discussion for this tutorial. So see you next time and God bless.